Sandra. Marco and I were thinking of throwing a small Christmas get-together for our families. What do you think?
Yeah, we each bring one dish and celebrate with our families. I'm sure our children will love to meet for Christmas.
That all sounds very lovely, but I just can't afford to make food for so many families.
I'm sure your job will give you a break if you ask them.
It's not just my job. I applied for medical insurance to the state, but my job doesn't offer any, so I got denied. So I have to save up money to treat my pulmonary disease and make sure I have enough money to provide for my children.
We had no idea you were going through all this. I'm so sorry.
Can we do anything to support you?
Thank you guys, but it'd be wrong for me to take money from you. I'm working 2 jobs to get the money that was spent on moving and security deposits. So you see, financially, I'm unstable, and I just can't make enough food for so many families. As far as Christmas meals go, we'll be eating McDonald's or something.
It's okay, Sandra. We completely understand, and if you ever need help with anything, we will help you out.
I also heard about Gleaner's Community Food Bank. I believe they could help provide food for you and your family so that all of you guys could be well nourished.
I will look into it. Thank you so much.
Of course.
Hi, I'm Aleena.
And I'm Riya.
And I'm Riya Mathur, and this is our public health presentation on food insecurity. The skit you just watched was based on a real woman in Detroit named Sandra Davis. Sandra is among the many who suffer from food insecurity due to the unstable factors in her life and her financial life. Sandra works 2 part-time jobs, and neither job offers health benefits. Because of this, she applied for medical insurance through the state but was denied. She also struggles with chronic obstructive pulmonary disease and is having trouble affording her treatment. Sandra does not have enough money to buy healthy food for herself and her family, and she cannot afford medical care. Her family eats mostly fast food, which is not enough to keep a healthy body. As a result, her family and her suffers from food insecurities. Now on to Aleena.
What is food insecurity and what makes it a social determinant? Food insecurity is defined as not having enough reliable access to a sufficient quantity of affordable and nutritious food. According to the United Nations Committee on World Food Security, food security is defined as the means that all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food that meets their food preferences and dietary needs for an active and healthy life. A social determinant is the economic and social conditions that influence individual and group differences in health status. When someone or a group of people are food insecure, it is hard for them to live up to the health standard, and life becomes hard for them to balance. People struggle with having stable money for all.
Now, I would like to speak about how the pandemic has affected families dealing with food insecurity. Starting off with pre-pandemic demographics. 18% of people were able to stock up food for 2 weeks during March. And during 2019, food insecurity affected 13.6% of households with children. In some of these households, only adults are food secure. 44% of low-income adults are food insecure. In some of these households, only adults were food secure. And most children living with low-income families were experiencing harsh situations during the pandemic. The COVID-19 pandemic has intensified the effects of food insecurity. Due to school closures, many families were dependent on food shelters and food banks. 1 in 4 households were experiencing food insecurity during this time, and around 13 million were worried of when the next meal could come or what the next meal could even be. And 1/3 of these food insecure families had inconsistent food patterns, and their food intake was reduced severely. The coronavirus pandemic has worsened this problem, doubling the data to around 23% of people experiencing food insecurity. We believe this is due to school closures, layoffs in jobs, and more. In this graph, you can see that it shows the percentages of food insecure with adults and children. So social and economic approaches were taken to minimize the risk of the virus in school, such as school closures and limited access to school lunches. Next, Aleena is going to talk about the causes of food insecurity.
Food insecurity is a result of many different cases, such as race, Food insecurity is heavily connected to racial inequality. For example, African American households are 2 times more likely to experience hunger compared to white households. This is due to many factors regarding oppressive policies that affect them to this day. This is represented in the graph to the right, where you can see that Black and Hispanic households are more likely to face food insecurity. Employment. Unemployment can cause an instability in a household's budget. This leads to food being less affordable. Disability. A reason one's disability can cause food insecurity is because they will experience more medical expenses. People with disabilities are also more likely to receive decreased earnings. Other household status. One's household status can also include factors such as number of kids or marital status. Depending on those, people may have limited money and less access to nutritious food for different periods of time. On to Riya on the effects of food insecurity.
What are the effects of food insecurities and who does it affect? There can be varying effects of food insecurity. These include lower food quality and variety, reduced nutrition due to prioritizing other necessities over food intake, health issues such as obesity, anxiety, stress, anemia. Food insecurity can affect many people. Children, adults, disabled people all face insecurity due to different reasons. In more severe cases, some may prioritize medical bills or other life necessities over purchasing food, resulting in reduced food intake. Worrying about where you or your family's next meal is coming from can add stress to an already full plate. Now on to Aleena.
Why is food insecurity a public health issue? Food insecurity causes many risks in both adults and children. If adults aren't able to access a sufficient amount of food, they can develop chronic illnesses. When children face this, their development is at stake. This is a roadway to more hospital visits and medical treatment. So, food insecurity is considered as a social determinant of health, or SDOH, due to the fact that if one is unable to obtain food, nutritious food specifically, their health and well-being can be at direct risk. On to Riya on how we can aid food insecurity in our own community.
Our community and HOSA should start spreading awareness about food insecurities and people who suffer from it. We can start spreading awareness into schools through social media and flyers. We should inform people about the effects and causes and what they can do to help. We should also inform people about various food pantries in Detroit, such as the ones in the slide. Metro Detroit has many food pantries and the food banks and food banks where they provide the money and the food to have a sufficient meal with your family. And as being a HOSA member, we can spread awareness to our community by educating the community on donating to these food pantries and showing them how every cent makes a difference. This food pantry that we were talking about Sandra to donate to was Gleaner's Food Bank. Now on to Riya.
This is an example of a flyer we can post around school. That concludes our presentation. We made this presentation about this topic to spread awareness because it affects many people and plays a big role in one's health. We believe no one deserves to fall under immense stress and endure health issues because of food accessibility issues. Thank you for listening.
Have a good day.
Bye.
Bye.